It is the leading cause of work disability and impacts 24% of American adults, according to the CDC. We're talking about arthritis. Luckily, our local chiropractor and wellness expert, Allyson Coffin, Dr. Allyson Coffin, don't want to forget the doctor part, is here with some tips and tricks for those with arthritis. And first question I have is, what is it? What is arthritis?
Arthritis is an inflammation of your joints. A lot of times it's diagnosed by x-ray because you have like joint stiffness and pain, and so your doctor will order an x-ray and then you'll see the inflammation in your joints. Happens in our hands, feet, knees, heavily used areas. Usually happens first. There's many different kinds of arthritis. I will not, it's boring if I tell you all of them.
Bore you with those details, yeah.
I'm bored with those. But arthritis can be painful.
Yes, very painful.
And so we really want to know how to mitigate the pain and feel better in like really tangible, easy ways, because if you're in pain, it's not like you want to go for a 10-mile run. You do not.
Yeah. Can it impact like any age, or is there a certain age it impacts more? Okay.
Yeah, so there's juvenile arthritis.
No
So you
way.
can get it when you're a kid.
Wow.
Which is sad. And then there's, of course, the most common arthritis is older arthritis. You get it when you're older. And then if you have genetic factors, you're definitely more predisposition to it. Like I know my grandmother, she had like, her fingers were a little crooked.
Yes.
Yeah.
Yes.
And so you're like, oh, that might be me someday. And so when your fingers start to get a little crooked, you might want to look and see if you might have arthritis. Talk to your doctor about that.
Absolutely.
Yeah.
So supplements that people can take? Okay.
So there's there are medications you can take. You got to talk to your doctor about that. But there are supplements which are amazing for arthritis that a lot of people don't know about. So one supplement that you can take is actually found in fresh pineapple. So I think pineapple is delicious. And it has this enzyme in it called bromelain, and if you cut it up and eat it, the enzyme helps decrease arthritic pain.
Okay.
Yeah, which is pretty cool.
That is pretty cool.
Yeah. And then the other supplement that you can take is a fish oil supplement. So fish oil is, of course, great for our brain. Many of us know that, and for your heart, but it's good for your joints because it's oil. Think of an oil can. If you get it into your joints, it feels better. If you get more flexibility in between your joints. Yeah.
That makes so much sense. Okay, so do the supplement route.
Yeah.
What about movements that we can do?
So we want to do the low impact movement is the best because you don't want to aggravate the arthritis. So if you can go for a walk, cool. But if you can't, say you have arthritis in your knees or in your hips, going for a walk isn't that, like, you don't want to do that.
Okay.
So going to your local pool, swimming is good. Water aerobics can be so hard. Like so good for your body.
Right.
Those are good ones. A recumbent bike, so not the bike like a Peloton bike, a recumbent bike where you're sitting down and riding the bike. It's more comfortable and it helps your joints move, so it lubricates your joints really well.
Okay.
Yeah.
Are there any that you can just do while we're like standing here?
Yeah.
Okay. Fantastic. What do they look like?
So they're really easy, but you got to make sure that your joints aren't currently hurting, and the more you do it, like the more range of motion that you'll get in your joints. So just wrist circles are really easy. So you start with your hands like this, and then you go around in a circle, and then you go the opposite way. That just mobilizes your joints. If it starts to hurt, stop. Okay?
Do you hear that? Don't keep doing it if it's painful.
Yeah. Then the other one is a good one to do is our hands, or like I said, usually are a place that usually gets arthritis. So you put your hands together like this, like in a prayer position, and then you push down. You get a good stretch through the bottom of your wrist and through here. That usually feels pretty good.
Yeah.
And then other really easy ones is neck range of motion. A lot of people in my office, I see arthritis in their spine. And so if you do gentle range of motion, just ear to your shoulder, you're not stretching, you're just moving it back and forth. And so if you maintain that range of motion of your whole head, make sure you look up too.
Okay.
It's going to decrease that arthritic pain and make it feel more mobilized. You can move a little bit better. So everywhere in your body. In your mid-back, you want to make a little circle and stretch.
Whoa, this is a good one.
And that feels great. And then you can let that go. Other ones you can do is just arms overhead and reach side to side, like you're going to dive into a pool.
Before water aerobics.
Before water aerobics. And then the other one that you can do in bed is you just bring your knee to your chest. And you squeeze it in, and that helps with your low back. And if you don't have the flexibility to hold the outside of your knee, you just hold the back of your leg.
Okay. Yeah. You're saying while you're laying down?
While you're laying down in bed.
Okay, yeah, I'm going to let you do it while you're standing up because I will fall over and hurt myself. I don't want to do that.
No, that's bad.
This is great. All right, so we're going to have all of these tips and everything about arthritis right in the 207 section of our website. Thanks so much for coming in, telling us all about it, helping us. Stay with us. 207 is back right after this.